Hepatitis C is a small virus that preferentially affects or infects the liver, and over long periods of time can lead to liver cirrhosis and liver cancer. And currently, and as a result of that, it is the main indication for liver transplantation in the United States. And beyond that, the number of patients with cirrhosis and liver cancer related to hepatitis C is on the rise, primarily because the number of people who've been infected with the virus for more than 20 years is now on the rise and is not expected to peak until sometime between 2020 and 2030.
We're here to talk about hepatitis C, and this is an exciting new initiative for our NMA. We know that hepatitis C is rising at a great rate in our populations and is becoming almost an epidemic. And the good news is that we can test for it. The even better news is we're getting even better treatments to cure it, especially in our populations. Today, what you will hear will be multiple talks that will talk about the epidemiology and the overview and some of the treatment for it, and more importantly, we'll talk to you about what the NMA is doing with our hepatitis C task force to try to address this issue as it relates to our communities, to our patients, to our families, and even to us ourselves.
We are very excited about the NMA Hepatitis C task force. So I just want to give you just a little brief information just to reinforce some of the things that you already know about hepatitis C. It is well recognized that the hepatitis C virus infection has become a major health problem in the United States, resulting in some 10,000 deaths annually. This number is expected to increase significantly by the year 2020. Some estimates indicate that the increase may be as much as threefold. It is of interest that although all races in the United States are affected by the hepatitis C virus infection, the most common chronic blood infection in the United States, African Americans have more complications from this infection than whites, and their response to therapy is much less.
It's been established and actually known for a long time that there's a greater burden and disproportionate burden of hepatitis C in the African American community. First, the prevalence of infection is twice, in African Americans, is twice that that's seen in Caucasians or whites, 3.2% versus 1.5%. And when you break down the number of cases, at least based on NHANES, related to race and ethnicity, you find obviously that the majority of cases are found in Caucasians, but close to 1 million African Americans are estimated to be infected with hepatitis C. Now, as many of you know, the NHANES study has some limitations in that it only surveyed non-institutionalized individuals, and there are other estimates that the prevalence of hepatitis C, chronic hepatitis C, may be between 5 to 8 million persons. So based on these data, I estimate that there probably are somewhere between 1 to 2 million African Americans with hepatitis C infection. And during the time frame of the NHANES study, African Americans accounted for about 12 to 13% of the population, but 23% of the HCV cases in this country. So a huge burden in terms of the number of hepatitis C cases. And then if you look at the prevalence, the age-adjusted prevalence of hepatitis C, you see that among African Americans between the age of 40 and 49 years, approximately 9% of African Americans, 1 in 10 are infected, are estimated to be infected, compared to 3.8% for Caucasians. And so when one begins to look at complications of liver cirrhosis, you see that the, particularly in this case, the primary hepatocellular carcinoma, HCC, that the incidence of infection seems to correlate fairly well with the racial differences that's been seen in prevalence. And I'm not going to go through all of this information because of time considerations. But the point is that primary HCC, the number of cases has been increasing in the United States over the last 2 decades. And this has been seen in all racial groups. And it's particularly a problem in males.
I'm Dr. Sharon Allison-Otti and serve as the NMA Health Strategist. And hepatitis C has been adopted as one of the national platforms of the National Medical Association. You're going to hear about hepatitis C for the next upcoming years, has a multi-level, multi-layered approach. We are certainly very happy that the section chairs for both internal medicine and family medicine, pediatrics and community medicine agreed to host this joint section. We have over 300 physicians that have been in the room today, and we are very happy, again, that these sections thought it right to partner certainly with the National Medical Association in promoting and educating on hepatitis C. However, there are other specialties represented in the room. I've seen radiology, psychiatry, I've seen surgeons in the room, and that really speaks to what Dr. Howell was saying. And the beauty of the National Medical Association is that we do have 25+ specialty sections, and hepatitis C really touches all of the patients that are touched by those physicians. Under the direction of Dr. Bright, the National Medical Association began to actually formulate the plan for how we should, as an organization, address hepatitis C. And this is very important because what I'm going to present briefly is the data. So it is not like the board or a subcommittee sat in a room and said, this is the plan. We first went to the experts within the NMA on treating African American patients, and that is you. All physicians within the body of the NMA are experts in your own right, in your specialty area, but we do know from our statistics that our physicians treat a larger percentile of minority patients versus our white and counterparts. And so we went first in developing a very strategic national plan to our experts to talk about what perceptions were and what they were seeing in their offices. And this is the data of your organization. We got together 2 focus groups and completed a physician survey. The physicians in both of these were represented, most of the specialties were represented. And again, in the essence of time, I'm going to flash through to the results. But phase 1 of our project was to conduct research aimed at gaining invaluable insight into the necessary components required to develop, execute, and implement a successful awareness, screening, and treatment campaign that would appeal to healthcare professionals and patients. So a survey tool was developed, tested, and fielded to first the NMA scientific section department chairs and to NMA physician leaders. It was important that we brought academia and the section chairs together with NMA leadership as we asked the questions, and remembering that as a physician organization, these are also physicians, the majority of which, and I think it was 83% of which, are still seeing patients. The survey simply had 32 questions. The data was collected and analyzed. We did use scientific methodology in developing the survey and executing the survey. The 3 major areas discussed were hepatitis C in the African American patient from a clinical standpoint, and then public health awareness campaign, as well as diagnosis and treatment barriers. You see the demographics of the majority of the physicians. It's important that the majority had been in practice for greater than 20 years, and my statistics, it was greater than 90% were still currently in clinical practice with various practice settings. And again, phase 1 provided the quote-unquote ingredients within a short period of time for a substantial hepatitis C awareness and action campaign to be developed by the NMA that was founded on data. So now, here are some of the pertinent findings from the study. Number 1, do you think hepatitis C is a major health concern in America? 100% said yes. Number 2 is like duh, right? Okay. And number 2, do you believe that there is inadequate education and awareness of hep C with both physicians and patients? Guess what they said? 100% said, as it relates to patients, 100% said absolutely yes, there is inadequate education. I think there's a typo on the slide. And then adequate physician education and awareness, 83%, and versus 85%. The red are the section chairs, and the blue is the NMA leadership. Survey respondents believe that media and community outreach are top choices to raise Hep C awareness among patients, as well as increasing traditional CME programs, journals and articles, and online materials and direct mail. And this actually should say among physicians, because we are talking about CME programs. Now, when we talk about patients, you can see the numbers. 78% of the NMA leaders said discussion with practitioners versus 61% of section chairs. And you see the leadership and the section chairs were pretty much in step on major areas. Patient info in offices and clinics, media outreach and community outreach and screening all were above the 60% threshold. Specific to African American, the previous slides were for all Americans, but now specific to African Americans, is Hep C a major health concern for Americans? 90% versus 10% said yes versus no, and then more of a health concern for a particular ethnic or racial group. You can see 89% versus 64%. When we talk about increased awareness, we of course have to talk about increased screening, and we asked particularly what are some of the barriers. Hepatitis C screening tools are desired and would be used, but few physicians are aware of in-office tests that meet their practice needs. So most physicians want to screen for Hep C. However, few physicians are aware of quick and efficient screening tools for Hep C, which again speaks to our need to educate physicians. So we did the survey, those are some of the findings, but we also had the focus groups where there was a robust discussion around the following. Barriers to addressing hepatitis C, and Dr. Howell did hit on a lot of these, but these are what the focus group said. 95% of participants believe that Hep C should be a topic of major focus. And then we talked about the why. Complications from viral hepatitis C, particularly cancer, and instead of baby bombers, although many of you, how many baby boomers in the room? So you are the bomb, so this really isn't a typo. Increased prevalence of African Americans and baby boomers, and we should not wait until the epidemic continues. And then how should we address this? Increased awareness and testing, emphasize prevention and early detection, including secondary prevention, and updates on new treatments. Should hepatitis C be part of a routine screening panel? You can see the results here. All adults per the focus group, and this is actually back to a little bit of our data from the survey, 25% of adults, and then you see 90% of African American adults, African American pediatrics and adolescents, only 25%. Now, barriers that were identified in the focus groups are standardized testing, who gets tested, cost and reimbursement, stigma. Physicians stated that their own barriers for addressing hepatitis C included all of these things, and this is before we really even get to the patient. Time management was a major issue. Okay, and then there was a sub-discussion, and we know that we did hear the risk factors for hepatitis C. There is really a, not even confusion, but a need for increased education around the barriers, because often there is such a direct connect with sexual history versus not, and this was evidenced by even the focus group saying we have discomfort in discussing sexual issues, which we know is actually a secondary issue, but certainly if there's discomfort discussion sexual issue, a history of IV drug abuse in a 72-year-old patient may be something that you have a little bit of discomfort discussing. Other barriers, participants believe that patients will candidly discuss their sexual history with their physician in these particular areas. But again, we have to talk about another sensitive issue, and that's IV drug use, and will that be discussed? As it relates to other barriers, we have cultural relevance of hepatitis C, materials and outreach for both physicians and patients that are both health literate, culturally sensitive and relevant. Why me, why my patient is the question that all materials should ask and answer, and we have to talk about stigma. So, recommendations, particularly among, after the focus groups and the surveys, were physicians, we need to increase education and awareness of hepatitis C. This is one step in doing so. A call to action with the engagement of actual physician offices around the country is vitally important for all of our members, especially with the new CDC guidelines. How many physicians in this room treat patients over 65? Okay, and we talked about now the CDC recommendations on screening. When we talk about patients, and this is what came out basically from our survey and focus groups, increased patient awareness and education, increased screening and understanding of treatment options, pros and cons, and compliance issues. The recommendations are that there should be a national awareness and education campaign led by the NMA, but in partnership with other physicians and civic organizations. You've seen at this meeting and heard, and many of you have screamed during pictures and videotapes, and we'll be asking you to do that again in a minute, that We Stand With You, which is a national platform of the National Medical Association, NMA physicians and their patients, united for improved health for all. The Hepatitis C Initiative is a physician-based and patient-based program that is under that banner. And we really need to appeal to all patients with increased focus on the at-risk populations and involve various aspects of our community. Physicians cannot do it all. We must depend on our partnerships, civic organizations, and the vast relationships of the NMA. Other recommendations are, again, a massive national screening and awareness campaign. The NMA has submitted a funding request with 5 cities targeted, where we will be hopefully opening the doors of your offices and saying, would you like to participate in our national program as one of our centers? But then we are issuing a call to action for all physicians to increase health awareness around hepatitis C, as well as develop materials that are culturally sensitive and relevant from the National Medical Association in your office. Also developing a rich pipeline, because what happens when you screen, where do you send those patients? And NMA cannot do it alone. And so to have a referral base and a place to send our patients is absolutely essential. I'm going to move quickly because, so we asked the physicians, but we then said, wait a minute, we forgot one important piece. So we asked physicians, what are your perceptions on hepatitis C? But it's physicians and patients, right? So we were able to now go to patients, because we are the vast resource of African American physicians, has the NMA, but also the NMA has patients. So we recruited 3 doctors' offices and did a survey in those doctors' offices. And this is a pilot which we actually want to nationalize and gain the largest survey ever of African American patients. And I hate to say it, but it is true. Our pilot is actually the largest survey of African American patients that exists now. Our survey on physicians is the largest survey that we have been able to see with African American physicians. So if NMA can do those things in a pilot, we certainly can do a national plan and just blow the statistics out of the water. So we went and asked patients, what is your knowledge base of, what is your knowledge base around hepatitis C? And I'm going to just go right through to the results. We had vast demographics, which you can see, that were split, with the largest demographic being 60 to 69 and 50 to 59 as important. We asked, of course, the patients, what is your ethnicity? 62% were African American. Have you heard of hepatitis C? 76% heard of hepatitis, not hepatitis C. Have you heard of hepatitis? 76% said yes. If yes, what part of the body does hepatitis primarily affect? You can see that we have a knowledge gap. Although 41% said, 41.8% said liver, heart is 27.4, eyes are 10.9. We have some work to do. Have you heard of the virus hepatitis? Again, we asked that, and you can see we then asked for A, B, C, D, and G. And you can see most persons had heard at 71.8% of those that responded, yes, I've heard of hepatitis. Now we ask, have you heard of the subtypes? And hepatitis C at 71.8%, hepatitis B at 71.8%, followed by hepatitis C at 47.9%, and A. And then D and G at 4.9%. Have you ever been tested? And these next few slides are very telling for us as physicians. Have you ever been tested for any hepatitis virus? 81% said no. If you have been, of that small segment that had been, what was your status? What is the largest here? I don't know my status at 64% versus positive 14%, negative at 22%. We have work to do. If positive, which virus were you positive for? You can see hepatitis B followed by hepatitis C were there, but the biggest percentile is I don't know which virus. Have you ever been tested for hepatitis C? 83% said no. And remember the demographics that I showed, that over 50+% of our patients that were in this survey actually were 52 plus 70 plus years old. And then if yes, what was your status? 88% said, again, I don't know. 8% were negative, 4% were positive. And then we asked a very telling question: who should be tested for hepatitis C? And we can see that this kind of brought out some of the misperceptions that are out there, and some we were pretty good on. People who have shot street drugs, 100%. People who have received blood clotting factor concentrate, 100%. People who have received a blood transfusion before 1992. People who have received a blood from a donor who later tested positive for HCV. All persons over 65 years old, only 26.1% said yes to that. Patients who, or people who have signs of liver disease, 78.1%. And then you can see the other numbers, including people on dialysis. Men who have sex with other men, and this is the close linkage, was borne out both in the physician study and the patient study to the perception of the huge sexual linkage. And that was men who have sex with other men, 100%, men who have sex with several women. And you see, again, people with tattoos at 100%, body piercing at 100%. All children and teens, 48.6% of the respondents said, yeah, they need to be tested for hep C. And then in this case, 51.3%, when we asked people younger than 65, 51.3%. Finally, would you like to be tested for hepatitis C? And this is important for practicing physicians. 52% said yes, 48% said no. If your doctor asked you to be tested for hepatitis C, would you be tested? 100% of the respondents said yes. This speaks to the close connection, particularly in minority communities, with their physicians, that if you ask, they may not take their pills right, but if you ask, there is such trust, particularly with minority patients, and NMA has published this, that they will agree to, at minimum, testing. And so this is why patients have to be educated, but we have to be educated, so we do ask. And then, if your doctor could test you in the office, would you be more likely or less likely to get tested? 92% said, I will be more likely to be tested in my doctor's office, with 7% said it really doesn't matter where. That is a significant statistic. Do you want to know more about hepatitis C? This is important because we're talking about developing pieces for your office as materials. Well, if our patients in the survey said, no, I don't want to know anymore, that would be a waste of energy. But 93.9% said, yes, we do. Would you read a brochure from your doctor on hepatitis C? 93.7% said yes. And then we asked a few other questions. Number one, do you know, is there treatment for hepatitis C? 74.8% said yes, which is pretty good. And then we said, true or false, there is no cure for hepatitis C. 96.9% said that is actually true, there is no cure. Can you get cancer, which is key to our public awareness campaign? Can you get cancer from hepatitis C? 87% said, no, you cannot get cancer from hepatitis C. We have work to do. Somebody say work to do. I want people to keep in mind that this is a conference to really empower, educate, and inspire, but the work gets done after the conference, and thousands of physicians will go back to their offices greeting hundreds and thousands of patients. We now want patients to take control of their own health in conjunction with the physicians, and really it is a physician-patient partnership. That's what the National Medical Association is all about.
Over the years, since 1991, has been significant advances in treatments for hepatitis C, such that now we have therapy that can cure more than 50% of patients, even those with the most difficult to treat form of hepatitis C known as genotype 1. And so the real challenge at this point is identifying people who are infected with the virus and getting them into care and treatment, because we know that if we eradicate the virus and cure this infection, we can prevent complications such as cirrhosis, liver cancer, and the need for transplantation.
Early testing is essential. There are so many people who have no reason to suspect that they have hepatitis C, but we're finding that the baby boomers, people that are born from 1945, 1965, those people that are being tested, we're finding that a high percentage of them will test positive for hepatitis C. So we are recommending that physicians encourage their patients to be tested for hepatitis C. If we test them, we find out they are positive, then of course early treatment will usually lead to an early response. And as I said, we are looking very hopefully to being able to use the word cure for hepatitis C.
I want to salute the National Medical Association for its efforts to address the hepatitis C problem in the African American community.
Hepatitis C is a rising epidemic that we're seeing among our baby boomers populations, and it leads to a lot of liver cancer that folks do not know about it because it's very silent. Folks don't know that they actually have it. It's asymptomatic. So what we're stressing as the NMA is for people to get tested for it, that are at certain age groups, our folks over 65, our folks who fall into the baby boomer generation, meaning those born before 1965, and because now we have effective treatments that can help decrease their chances of going on to develop liver cancer.
We invite you to go to www.nmanet.org, which is the website, or call the national office at 202-347-1895. We invite the faith community, civic organizations, other organizations to join with us in our national campaign entitled We Stand With You. I'm Dr. Sharon Alisonati, and I serve as the NMA Health Strategist and Consultant. One of our major issues is to implement and execute a great public health agenda, and that's what the National Medical Association is doing.